Today we will discuss about the medical word hepatic encephalopathy. Hepatic encephalopathy is brain dysfunction caused by liver dysfunction. Encephalopathy is brain dysfunction and hepatic means liver related. Encephalopathy affected our central nervous system. Hepatic encephalopathy is also known as portosystemic encephalopathy. Happens when liver is not filtering toxins as it should. These toxins build up in blood and affect brain function, causing confusion, disorientation and other changes. This condition is life-threatening but can get better with treatment. Hepatic encephalopathy can show up in wide varieties of ways. Not everyone will have every symptoms. It can affect mood and personality, behavior and impulse control, memory, concentration and thinking, consciousness, lucidity and sleep pattern. It also affects coordination and motor functions. Symptoms may occur suddenly or come on gradually, and they may be steady and lasting or come and go in episodes. They may get better or worse depending on overall health condition. Healthcare providers sometimes group symptoms by their severity as a way of grading the disease. The West Haven criteria is the most common grading system healthcare providers use for hepatic encephalopathy. It grades symptoms on a scale of 0 to 4. Stage 0 to 1 are sometimes called minimal hepatic encephalopathy or covert hepatic encephalopathy. Symptoms in this stage may not be outwardly noticeable. Stages 2 to 4, also called overt hepatic encephalopathy, features more obvious symptoms. Possible symptoms by grade are given below. Patients included in grade 0 category suffering subtle changes in short-term memory, concentration and reaction time. It is only recognizable to those who closest to the patient. They might show up on the standard neuropsychological test. Patients in grade 1 category suffering mild confusion or forgetfulness, mood swings like euphoria or anxiety, difficulties adding and subtracting, difficulties with fine motor skills like writing, sleeping during the day and waking at night. Patients including in grade 2 category suffering clear personality changes, inappropriate or out of character behaviors, lethargy and apathy, disorientation in time, slurred speech or dysarthria. Patients included in grade 3 category suffering slow thinking and sluggish movements, disorientation in space, drowsiness and loss of general awareness, severe confusion, delirium and amnesia, involuntary twitching, tremors or asterixis. Final and most worst stage of hepatic encephalopathy is grade 4. In this stage, patient become in coma because of total loss of consciousness. Any symptoms of overt hepatic encephalopathy are serious. It is important to treat the condition as soon as possible to prevent it from worsening or causing permanent damage. Severe hepatic encephalopathy can advance to coma or even death. If you see grade 3 symptoms like severe drowsiness, confusion or amnesia, disorientation in space and time or involuntary movement, treatment is especially urgent. Healthcare providers define different types of hepatic encephalopathy based on the original cause. Type A is caused by acute liver failure. This is a sudden loss of liver function due to the sudden or severe liver injury. Viral infections, autoimmune liver diseases, and acetaminophen poisoning are common causes. Cerebral edema, swelling in brain, is the frequent side effect that may contribute to the effect of hepatic encephalopathy. Acute liver failure is an emergency and some cases may require a liver transplant. Next one is type B hepatic encephalopathy. It is caused by a portosystemic shunt. Shunt is when blood flow bypasses its normal route through a new abnormal passageway. Portosystemic shunt is when our portal circulation bypasses liver on its way to systemic circulation. Body may create a shunt if there is a blockage in the normal pathway. In some critical medical condition, healthcare providers create transjugular intrahepatic portosystemic shunt. It is an artificial channel within the liver that establishes communication between inflow portal vein and outflow hepatic vein. It is used to treat portal hypertension in case of liver cirrhosis, which frequently lead to intestinal bleeding, life-threatening esophageal bleeding, and the buildup of fluid within the abdomen. Hepatic encephalopathy is a possible complication in both cases. Type C hepatic encephalopathy is caused by chronic liver failure. Chronic liver failure is the gradual decline of liver function from chronic liver disease. It is not reversible. Chronic hepatitis C, chronic alcohol use disorder, and metabolic dysfunction associated steatotic liver disease are common causes. At this stage, extensive scarring in liver may prevent it from working right. Scarring may also compress portal vein, triggering a portosystemic shunt. Most common medication prescribed for the treatment of hepatic encephalopathy include rifaximin. It is an antibiotic. It is non-absorbable by intestine. Neomycin is an alternative. Many of the toxins formed in our blood are byproduct of certain bacteria in our gut. Doctors may prescribe antibiotics to reduce the number of these bacteria. Lactulose is also included in this medication. This synthetic laxative draws water into bowels. Antibiotic combined with an osmotic laxative to speed up the passage of food waste through gut and reduce how much it can absorb into bloodstream. Supplemental medications also included in the treatment of hepatic encephalopathy. Branched chain amino acid supplements can help build muscles and clear ammonia from blood through muscle tissue. Probiotic can encourage the more helpful type of gut bacteria to compete with the less helpful type of bacteria that produce neurotoxins.